Victorians are tonight under curfew, while COVID has now invaded a cancer ward in Sydney's St George Hospital. Associate Professor Miriam Levy's chair of the Staff Medical Council at another hospital, Liverpool, which has battled its own COVID outbreak that's claimed 8 lives. She is desperately worried that people are now avoiding hospitals and depriving themselves of critical care. Professor Levy, thank you for your time. We wanted to talk to you because we figure you are all at the front line of this, and we want to get an insight into how our hospital system is coping. We have heard only just in the last hour or so that another Sydney hospital, St George Hospital, has had an outbreak in the oncology ward, and I guess you understand exactly what they're dealing with right now, don't you?
Look, I'm really grateful for the opportunity to speak to patients because we're starting to get worried that these small outbreaks are going to make people frightened to come to hospital. And actually, there will be outbreaks, and we've strongly encouraged vaccination so that you have a much better chance of protecting yourself. But overall, if you have acute medical problems, staying at home is not the solution. We do have to get through this epidemic. There will be breaches, but I think overall, considering that behind me, Liverpool is an 800-bed hospital, except for those early outbreaks, now all the staff are wearing N95 masks and goggles, looking after patients with gowns and gloves. And I think that the fact that there's been so few outbreaks with such a highly infectious strain of virus tells you that actually, for the most part, patients should feel safe coming to hospital. If you present with a ruptured appendix, or if you present with a massive myocardial infarction, a heart attack, instead of with chest pain, you're going to do much worse. People should trust the hospital system, get vaccinated, and use the hospital system for what it's there for.
How many people do you think are delaying their visit to hospital? I mean, are you hearing this anecdotally? Do you have data? I mean, how can you...
No. I'm not an expert. I don't have data. In our department, we normally have about 45 inpatients at any one time. And in the last couple of weeks, it's down to about 25. The emergency department is seeing less presentations for non-COVID reasons, so it's a concern. Actually, I brought these N95 mask and goggles because that and gloves and gowns is what we're always wearing. If you're hearing impaired or maybe your English is not great, by the time you put all of that on, it's quite hard to understand what someone is saying.
And that is what you're dealing with when you deal with your patients at the moment too, is that you're all masked up, and so you're dealing perhaps with people for whom English isn't their first language, for example, who are maybe a little bit older and they can't hear so well, so they're not able to look at your mouth, they're not able to see your facial expressions, they can't have their families with them. How are you managing that?
With sympathy. It's really hard for patients, and all of us are feeling, and we are all, and the junior doctors and the nurses need a huge shout out because they are working really hard, wearing this all day, and trying to compensate for the lack of those things, like having family with them. It's really hard on the patients, and we're desperate to get through to the other side of this pandemic. And unlike last year, if you think about it, if we were facing these kind of numbers last year without a vaccination, it would be absolutely terrifying. But it's still really tough. And, my heart goes out to those patients at St George Hospital. Despite the fact that we want to get through to the other side so we don't overwhelm our health system, actually, the patients are being well looked after with COVID.
People react emotionally in a situation like this, and you can understand some of the families of people who were patients at St George are now saying, I brought my loved one here expecting him to be looked after, and now he's got COVID. I mean, what do you say to those people when they're at a loss to cope with something like this?
The message is pretty clear that this is a very, very infectious virus, and trying to contain it is becoming incredibly difficult. It's the nature of the virus, it's not the nature of a hospital. There will be little outbreaks in places, particularly when people are vulnerable. Our outbreak was in a geriatric unit. These patients need help because they're weak, they need help to go to the toilet. Social distancing rules can't apply as easily. So, you know, as a community, we need to get through this with vaccination because vaccination is what will stop the numbers of people infected with a virus that's often causing asymptomatic infection. It's not a fault of, you know, a particular health system, a particular healthcare worker.
No, we understand what the health system is going through, I think. What percentage of your patients are vaccinated who could be vaccinated? Because let me say this to you, that it beggars belief to me that the high number of over 70s who are not vaccinated right now, they're our most vulnerable. They're the ones who should be stepping up. Why aren't they being vaccinated?
The hesitancy in that age group comes from their fear that maybe because they have an illness, for example, maybe they've got liver cirrhosis, maybe they're having chemotherapy, maybe they're immunosuppressed, maybe they've got an increased risk in their mind and that they want to check with their specialist or talk to the GP. And I'm not sure that that message has got through really clearly. There is no contraindication to vaccine, and so that it doesn't matter what comorbidity you have. Actually, the more comorbidities you have, the more likely you're going to have a tough time with a COVID infection. You're actually the very one who should be rushing to get a vaccination tomorrow, although everybody should be, obviously.
Tell me, what percentage of your staff are vaccinated?
We are all vaccinated, and we've been, you know, really fortunate that we've been vaccinated for some time.
Our hospital system is holding up so far, we're told. Are you worried about that into the future, into the not too distant future, if these numbers can't be wrestled under control?
I do think that if we didn't have vaccination, we would be facing an absolutely diabolical time over the next few months. But I think that the hospital still has a significant capacity to absorb. They actually have modelled and planned for quite substantial increases in numbers and are expecting that there will be. Many of us are physicians, even anaesthetists, and of course the emergency department all have capacity to assist the respiratory and intensivists if we need to increase capacity. So I think at a robust hospital like Liverpool, we're very fortunate.
Professor, we are all thinking of you. We thank you for your work and that of your colleagues, and thank you for your time.
Thank you very much, Tracy, and a shout out to the junior doctors who are working so hard through all of this, and the nurses.
To everyone, thank you.